I don't recommend necessarily going by these, but people ask, what will worsen my back pain? Some people cannot do extension. They've lost the disc height in their disc. It started with a disc injury, and now extension kills them. But what used to kill them is flexion or compression. Surgery may be considered in cases of trauma. Broken bone and torn tissues often need stabilizing. So all these things matter. We have to know exactly what's going on.
For those that don't know, my name is Brian Carroll. I live in Jacksonville, Florida. I'm a McGill Method certified provider, having power lifted for over 21 years and ending on a high note of being the first person to squat over 1,300 pounds. I now work with people all over the world from both a virtual standpoint and in person here in Jacksonville, Florida, with injury, resilience, and performance enhancement. I'm not giving you medical advice. For more information, go to powerstrength.com. Thank you so much. Enjoy this video.
So we got questions today. We're talking about these top questions on back pain, WebMD. I don't recommend necessarily going by these, but people ask, what do you think about these questions on WebMD? I'm going to refer you to different parts of back mechanics after we talk about some of these. So what is causing my back pain? That's the first question. Well, you got to do an assessment in 15 minutes with your care provider or your primary care physician or nurse practitioner or physician's assistant or chiropractor or physical therapist is not going to cut it. This can take a couple, 3-4 hours sometimes to understand and identify the cause or causes of back pain. That's why you need to do a mechanical assessment. Could someone in some serious conditions be causing my back pain? If so, which ones and what other symptoms? Have they been ruled out? That's why you need to go to a primary care physician to get an MRI and to understand what levels of tissue are affected. Isolate or eliminate red flags like Cauda-Equina syndrome, cancers and cysts and different things like that. So I do recommend, if you're thinking about reaching out to me, get an MRI, go to your primary care physician to start, get that process started, clear red flags, and then get your MRI. And then we can talk about specifics. What will worsen my back pain? What can I do to keep it from getting worse? Well, that's why you need the assessment to understand. Some people cannot do extension. They've lost the disc height in their disc. It started with a disc injury, and now extension kills them. But what used to kill them is flexion or compression. That no longer really bothers them anymore. So this is a very nebulous question. What will worsen my back pain? Well, we have to understand what kind of injury you have and what level your pain is or what level your damage is. And then we go from there. These nebulous generic questions, they're a good start sometimes, but we have to get down to the root cause of it. The next question 4 is on WebMD is, can stress be a factor? What can I do about it? Yes, stress can exacerbate an already mechanical cause of back pain or someone with already back damage or accumulated trauma in the back. And yes, stressing about it and focusing on it can absolutely exacerbate someone's conditions. But I've never seen someone stress and cause a back injury. Stress can be a factor for sure. We look at everything, this person's life, their job, what their daily routine is, what their hobbies are, what their history is. Do they have a history of being a ballerina or a dancer? Do they have a history of being a lacrosse player or a power lifter or a strongman? Or do you have to pull out of them that when they're in 8th grade, they fell on their ass and their back has never been the same, but they forgot about it? So all these things matter. We have to know exactly what's going on. How come when I get stressed out, my back pain starts to come on? Well, we have to see what is the root cause of back pain. Is it just stress? It's something deeper than that in almost every case that I've seen. What are my treatment options? That's number 5. Well, again, it depends. It depends on the cause of pain, what your symptoms are. And we're going to talk about in back mechanic when surgery should be suggested or explored. We're going to talk about that.
Looking for the answer to your sleepless nights, sore muscles, and better overall well-being? If so, PowerX Strength CBD has you covered. All of our products are made of CBD isolate and have 0% THC, meaning there are no worries of failing a drug test or the worry of feeling high. With PowerX Strength CBD, we offer a wide range of products and payment options to ensure you have the option that best fits your needs. Don't just take it from me. All of our reviews and client testimonials on our site speak for themselves. You can even get 20% off your order by using code YT1306 at checkout. Go to powerxstrengthcbd.com to order now so you can get back to sleeping, recovering, lifting, feeling, and being better.
Treatment options should always start with, in my opinion, the most conservative, and then medical, and then surgical. Start with the most conservative. Virtual surgery Go through and read the chapter on virtual surgery. And you can understand, first, try virtual surgery. You tried physical therapy, you tried chiropractic, you tried stretching, you tried mobility, all those things. Shut it down for a week and then go from there and then slowly start rebuilding. Are there things I can do at home or in my life to reduce my back pain? Hell yes, there are. There are many things, and all these things are discussed in back mechanics. I mentioned it earlier about virtual surgery, moving well, finding ways that does not or do not cause your pain, moving around your pain, learning how to use the hips instead of the back, building pain-free exercises and a repertoire that you can do to build capacity. Those are things that you can do at home. You don't need a gym. You don't need to pay for a personal trainer. You don't need to do all these extravagant PT exercises unless you failed with these things. Then you need to escalate from there. If you recommend surgery, what are the risks and benefits? This is a very loaded question and it needs some context. And I'm going to go in back mechanic and talk about those things. Some people, they say, my surgeon said we have a 100% success rate or a 90% success rate. It's definitely a loaded question because what determines a successful surgery? As Stu says here in chapter 3 of back mechanic, some surgeons state everyone does well with the surgery. There's no surgery that is without risk, nor is there one that always produces a good outcome. Clarify what the success rate of the operation is. The word success itself can be loaded. This is quoting from back mechanic. The word success can be loaded. In some medical reports, that means the patient did not die. Well, that's not really a great success rate then. Or they did well for a brief period of time. How long is that? What's a brief period of time? Well, I could make all kinds of crazy analogies right now, but brief is relative. Brief amount of time, is that a day or two they feel better because they're on medication and they've been in bed rest? Or are we talking about years down the road? You have to understand what they mean. And so you got to ask tough questions back to the surgeon. Okay. And they say, everyone does well with this surgery, 90% success rate. You're most interested in the longer term success rates compared to any other option. With a balanced understanding of both the risks and benefits, obtain the long-term results when you're picking a surgeon. That's how you know. After trying virtual surgery, there's a couple things that Stu mentions in back mechanic here that might make you a surgical candidate. But still, 95% of the people that we see that say surgery is the only option beat back pain without surgery. Just because someone says you need surgery does not mean that you have to go and get surgery. Make sure you surround yourself with competent clinicians and coaches. When looking at surgery, consider the following. First, always try the virtual surgery. I get that's a running theme here. Surgery should be considered when neurological issues and substantial loss of bowel or bladder control. Again, straight out of back mechanic. Radiating symptoms, numbness, muscle atrophy, all signs of a trapped or compromised nerve root. We've been successful mobilizing these with different types of nerve flossing that you can read about here in back mechanic. Just because you have a pinched nerve doesn't mean you go right into getting a back surgery. Those are some of the worst surgical outcomes. When someone has a little tiny disc herniation, they don't give it time, they immediately get surgery, then they get it again and again and again. And next thing you know, this person needs a multi-level fusion. And they went from just a little microdiscectomy with 100% success rate to being completely incapacitated with pain and multiple surgeries under the belt with no success. Always try some of these nerve mobilization exercises, but make sure you use a competent clinician to do them. Don't just pull on the nerve from above or below. You have to use the right type of nerve mobilization at the right time. Approaches to reduce the cause of nerve compression or irritation are also required. It isn't just a matter of freeing it up with some flossing. Surgery may be considered in cases of trauma. Broken bone and torn tissues often need stabilizing. People are going to need surgery sometimes to re-stabilize them because they've lost the integrity of their pelvis and their back and their spine and all these different things that can be crushed.
Hope you enjoyed today's video. Remember, like, subscribe, share, click the notifications because we drop videos twice a week. We also have a live stream every Friday where I answer your questions. Click below to see the latest video that we uploaded. Also, for our products, our CBD, our books that correspond with these videos, it's down in the description. For more information about all things Brian Carroll and PowerX Strength, go to powerxstrength.com. You could book a consult both virtually and in person with me. Enjoy your week, and thank you so much.